The flu season is here, and it's been on a steady climb as the BC Centre for Disease Control reports influenza has taken a part in the death of 3 children from different parts of BC under the age of 10 over the past week.
Influenza was identified in all of these deaths, but it wasn't necessarily the cause of each of these deaths. In all 3 of these cases, there was an associated secondary bacterial infection. That can be a complication of influenza illness.
BC Children's Hospital says it's seen a gradual increase in patients with respiratory symptoms, but that it's in line with previous seasons pre-pandemic. In 2022, the BC CDC reported 6 children's deaths from flu-related illness. Dr. Barmal says it was a very unusual season as we came out of the pandemic, and they're tracking this year closely.
This H1 strain is circulating. A lot of kids have not been exposed to it, and we know that it also tends to hit younger kids harder.
So when do you go to the doctor or emergency room with your child? Here are some symptoms to look out for. Fever in infants 3 months or younger, or those with pre-existing conditions, should go see a doctor as soon as possible. Labored breathing, drowsiness, not able to keep fluids down, or a fever that just won't go away. For many, the holiday season and time off school has meant getting over colds and the flu.
It's mostly like cold season. Like they have a lot of colds, but they're good now. But since school's been out, they haven't really been sick.
Coughing, fever, yeah. We're just out of it.
The health ministry is also watching this flu season, expecting the peak of the season to be in January.
This is a more typical flu season. It's still rising in BC. And so that's why it's still an important and possible thing to get vaccinated. And there are literally thousands of appointments available.
Jennifer Palma, Global News.
Hospitals across the province are also seeing more than their fair share of illnesses these days. Keith Baldrey joins us now with more on this. And Keith, looks like every health authority is operating at or past capacity right now.
Yeah, right across the board. This trend we saw of increased hospitalizations began in the summer. About 300 more people than normal are in hospital at any given time, and that number is increasing. So there are 2 types of hospital beds. There's base beds, 9,929 of those are in BC. There's also 2,281 surge beds, but we're already over capacity when it comes to those base beds. Surge beds are beds that are not assigned to wards. They can be in hallways and closets, for example, and they come into play when there's just not enough base beds to go around. And when you look at the health authority, here's how the numbers break down. Every health authority is over capacity when it comes to base beds. Fraser, 103.8%. Interior, North Vancouver Coastal has the highest rate of occupancy over base beds of 106.5%. The total average for the province is 103.5%. Health Minister Adrian Dix today talking about how these numbers of people in hospital right now are historic.
These are historically high numbers. They're not record numbers yet. But as we're still seeing the continuing respiratory illness season, and we're back to full efforts in terms of surgeries in our hospital, there are a lot of people in hospital right now. It's why a couple of months ago we increased the number of base beds in our hospital system significantly in order to meet what is certainly a continuing issue of high volume in acute care.
So Minister Dix says we're not breaking a record quite yet, but we're very close. I think we're just 7 short a couple of days ago, the numbers I just showed you, over last year's record, which was set last January. So we'll again keep an eye on the next 2 weeks. 2 big reasons why we're seeing more people in hospital. We have a rapidly aging population. The older you are, the more likely you are you need medical help. And also our population is surging. So just on a statistical basis, there's going to be, when we bring in about 140,000 people a year, a number of those people need health care, and that means more and more people are going into hospital.
Hard to keep up with some of those numbers, isn't it, Keith? All right, thanks very much. That's Keith Baldrey in Victoria.